Hi there, my name is Arthur Cummings and I'm a consultant ophthalmologist specializing in cataract and vision correction surgery. I work at the Wellington Eye Clinic in Dublin, Ireland, where most of my time is spent helping people see better without the use of glasses or contact lenses. I work closely with industry, serving on multiple medical advisory boards, and am also on the board of directors of a large public company in the eye care space. The comments today reflect my own opinion and not that of any other entity. I have no financial interest in Alatex, but did serve as a clinical investigator during the European clinical trial that has recently been completed. My key thoughts following the completion of the trial would be that, number one, I wish the product was already available commercially. Number two, the biocompatibility is 100% in my experience. Number three, the potential for this technology is enormous. Let me elaborate just a bit. I wish I could offer my patients the Alatex inlay now. Presbyopia, the Greek word for aging eyes that makes reading up close exceedingly difficult or even impossible, is a serious irritation to all of those that suffer from it. It is very frustrating to have to wear glasses just to look at a price tag, a recipe, a text message, and even more frustrating when you cannot find your glasses. And when your reading glasses are on, you cannot see in the distance. There are surgical solutions available, but none of them have included the simplicity, the reversibility, and the satisfaction levels that Alatex provided our study patients. Patients reported an enormous improvement in their quality of life after receiving the inlay. Knowing that they could reverse the procedure if some aspect of the result was unsatisfactory and return to exactly where they were before was extremely reassuring to them. The fact that only one eye requires treatment to achieve reading vision for those already blessed with good distance vision was another perk. Knowing that the corneal tissue came from an eye bank and that biocompatibility, that is, the chances of their own eye fully accepting the inlay was so high, was also seen favorably. Previous synthetic versions of corneal inlays for the same purpose worked well, but biocompatibility was an issue, and these inlays are no longer available. The future of this technology is very promising, not only for the more than 2 billion presbyopes on the planet currently, but also for other situations. One that comes to mind is the person older than 45 years of age who's having LASIK to both eyes to correct their distance vision. They would immediately require reading glasses. But if an Alatex inlay was placed in one of the corneas at the same time as the LASIK was being done, they would have had both their distance and reading issues sorted out in the same procedure. Long-sightedness, especially for young people in their 20s and 30s, does not have a good solution currently, especially for the higher prescriptions. I have read some of the early work in this area using Alatex hyperopia inlays, and it looks very promising indeed. I would sincerely hope that long-sightedness would be one of the additional products that Alatex bring their attention to. In conclusion, I would say that I'm eagerly awaiting the day that I can resume using this truly breakthrough, yet tried and tested technology to best treat my patients that want to lead a more youthful, less dependent on glasses lifestyle. Thank you very much.